Before you decide to pay £6,000 to £10,000 to get a certificate of sponsorship for an healthcare job in the UK, you need to watch this video to the end. And at the end of this video, I'll also be sharing with you some of the job opportunities available for healthcare assistants in the United Kingdom for those who are resident in the UK and also for overseas applicants. So if it's something that interests you, please stay till the end of the video. Hello guys, if you're coming across my channel for the first time, my name is Daniel. I reside in the UK and I share videos around traveling abroad. So if you're looking for a place to get first-hand information, guys, you're in the right place. Click on the red subscribe button below to join the amazing Going family. And for my returning subscribers, you guys are amazing. Thank you for being here. I really do appreciate you guys. So without further ado, let's get right into the video. It's no longer news that most people are actually paying agents unreasonable amount of money to get a certificate of sponsorship to move into the UK. Now it's not news, it's everywhere, everyone knows about this information. And however, before you decide to also, pay people to get your COS, either you're a resident in the UK or you're coming from the overseas, you need to ensure that you watch this video till the end. Now, despite the fact that people have been making complaints about, informing people not to pay to get a COS or to pay anyone to get an healthcare visa, the sincere truth is most people are still doing it. I've got calls from about 4 different people this week alone asking me about, oh, who can they pay? They've got in contact with someone who is willing to help them move into the UK and they are paying, the least I've heard in the last 1 week is £8,000 just to get an healthcare visa. Now, it's very important for you to know that all employer or all agents or employer recruiting agency in the UK who are offering visa sponsorship, now for them to get you a COS, it costs them only £199 for an employer to apply for COS for a candidate. Because if you want to apply for your healthcare visa, you need your certificate, your COS number, you need the employer's registration or license number also, and all of this information will be provided for you in your COS. Now, for your employer to register or apply for your COS for you, as I said, it costs them only £199 per candidate. Now, the question now is, why are you paying £8,000, £7,000 to get this same certificate of sponsorship? Now, it's very important for you to also know that a care home or an employer that outsource its employment of staff to an agent is probably very it calls for suspicion, because there are lots of people in the UK willing to get this job. So why would an employer outsource this job to an agent, bringing in people from the overseas? That's to tell you that people in the UK who have access to physical access to some of this care home understands why they are not willing to get sponsorship. Now, I've spoken to so many people in the UK who got the healthcare visa sponsorship, and 70 to 80% of the feedback I've gotten from those who are on this visa is negative. Many of them are going through hell with their employer. Many of them are not happy with the job. I know someone who recently told me that he got the visa sponsorship job, and he only worked for about, I think he worked 3 to 4 days every week, and the remaining 3 days or 4 days he's off work. He spent those days sleeping because of the stress he had gone through in the past 3 to 4 days. And many of these care agencies or care employers recruiting people from the overseas, the sincere truth is that most of them are domiciliary care. Now, domiciliary care means you need to work from one location to another, and they are not being paid properly. I think I mentioned in one of my previous videos, I spoke recently with a friend who got the healthcare visa, and she works 5 times a week, 5 days a week, 12-hour shifts, 5 times a week, and at the end of the month she got paid £900. How do you survive on £900 salary in the UK, considering the living the cost of living crisis, considering the rent, considering the amount of money you need to pay to meet up your financial obligation? I recently spoke to a lady who just got a care visa. She moved into the UK in January 2023, and when she was getting the job, the employer told her that when she gets into the UK, she will be working in a care home, and it's just for 3.5. That means she's going to do 3 long days and 1 half day shift every week, and she can decide to do whatever she want to do with the remaining days of the week. Only for her to get into the UK, and it's a domiciliary care job, and she is expected to work for 12 hours, However, she only get paid for 5 hours. Now this is because the other hours, the 7 hours, she's going to spend it on transit. So she's moving from one care one client to another client. So she's only paid the number of hours or minutes she spent in the care, in the client's house. So if she moved from one location to another and she spent 30 minutes in between the homes, she doesn't get paid for it. And the annoying part of the fact is that before she got the job, the employer promised her that when she gets into the UK, if she needs to pick a shift outside the care home, there's going to be a driver that's going to drive her around the care home, around the client's houses. But when she got into the UK, she wasn't getting any stipend for transportation. She wasn't getting any driver to drive her around from one client's house to another, and she was being paid a first salary. But got her so teary that she had to contact me and paid for my one-to-one section, and we had like a chat and call conversation on this, because she moved into the UK with different expectations, but the reality of her getting to the UK was not what she expected, and she had paid over £6,000 and also paid for her visa application. She spent almost £8,000 on this whole process, hoping to get into the UK, get stabilized, get an accommodation, then bring her family members in, her husband and 2 kids. But now, how is that going to be possible if she's earning £900 per month? So guys, before you pay for any care visa, ensure you do your due diligence. Ensure you read your contract properly. She also sent me a contract, and I discovered that the contract stated 0-hour contract. So if she doesn't work, she doesn't get paid. And that is illegal. That is not how permanent jobs work in the UK. You're on sick leave, you get paid the minimum, the base salary. But for this particular lady, a contract specifically stated that it's a 0-hour contract. I really don't know how she was even able to get a visa with such contracts. That's to tell you that most African care employers in the UK are very dubious, and you need to be extremely careful when you are applying for job as a carer with many of those agents or care employers. Now, I'll also be sharing with you some jobs available in the UK that you don't need to pay. All you need to do is go to our website and start applying. Now, the first care I'll be sharing with you is the Average Healthcare in Nottingham. They're currently recruiting night care assistants, and they're also providing visa sponsorship as stated on the application. I won't be sharing with you the roles. You all know what a care assistant is expected to do. Now, some of the things you get from this employer is that you get paid £9.70 per hour. You get enhanced pay options, because for you to apply for the care visa, you need to be paid at least £10 per hour. You also get workplace pension, you get refer a friend payments, you get free DBS and uniform, you get paid e-learning and training. So while you're doing your training, you will also get paid for that. So guys, check out the information on the screen and push out your application. Another care agency I'll be sharing with you is the Exemplar Care Healthcare Service Limited. They're currently looking for care assistants in Leeds here in the UK, and the position, of course, is a care assistant role, and the location is at Cross Green in Leeds, and you're expected to work full-time, 36, 42 or 48 hours depending on your availability, and you also be paid £9.85. Of course, you know the duties of a carer. You provide personal care, you promote independence, you support social and recreational activities, you maintain care record, and you also welcome and train new members of your care team. Now, basically, all you need to have as a care assistant is you have to be compassionate, and many of those things you already know if you're watching this video. And also, this particular care agency, have like a career growth plan for their care assistant. They have different trainings, they have different apprenticeship and higher apprenticeship programs. They also have like progression to go into a senior healthcare assistant or a central service role. And also, some of the benefits you get is paid DBS check, you get award-winning support services, you also get fast pay. That means you can access additional shifts and you get paid per day if you want, and you also get a company shop membership and free uniform and many more. So guys, I'll be sharing with you guys on this channel many other care home vacancies as they come up, and please guys, ensure you apply as soon as possible, because many of these vacancies don't stay for too long. And if you find this video useful, also click on the like button. If you have any other question, please state in the comment section. And if you're coming across my channel for the first time, click on the red subscribe button to join the amazing growing family. And for my returning subscribers, you guys, I love you. Thank you for being here. I appreciate you guys. So this will be the end of this video, and I'll see you guys in the next video. Thank you.